To tonight's original now, with in-depth reporting on a topic we've been keeping an eye on. And today, it's consequences of inflation, right? We've been talking about it for a while now. You could probably name 6 reasons why you don't love inflation, whether it's what you pay at the grocery store, what you pay at the gas station. For a lot of folks, more expensive costs mean getting serious about your budget, cutting back, less spending, maybe fewer times going out to eat or going to the movies or whatever. But what happens when important emergency services that are already spread thin from a couple years of the pandemic can't even afford to fill up their tanks? It's becoming a bigger problem in some parts of the country, forcing some fire departments and EMS services to limit the kinds of calls they can respond to. Our own Isa Gutierrez takes a closer look.
The high cost of fuel isn't just making your commute more expensive. It's also forcing emergency responders in smaller communities to cut costs.
We've never seen costs like this since I've been sheriff.
We're at 100% usage of our allotted fuel budget for this budget year already. I'm worried about the state of emergency response agencies throughout the nation.
I spoke with departments across the country who told me they're already having to or will have to make big sacrifices to offset the cost of gas.
One of the things we're doing today is we call it No Drive Friday. So the crews aren't really allowed to leave the station unless it's an emergency. We're also trying to reduce the number of vehicles that we send on an emergency response.
Decrease spending, purchasing new equipment, or possibly some of our maintenance items for the year. Those pre-disaster or pre-emergency activities that are labeled as non-emergency.
For some, it means not responding to non-emergency calls. For others, cutting back on patrols, building inspections, and training courses for staff. Today, the average cost of a gallon of regular gas in the U.S. at a whopping $5. That price tag expected to climb further in the summer months.
We're predicting a minimum of an $800,000 to $1 million countywide fleet vehicle increase in the fuel costs. And that cost is going to be astronomical.
The surge impacting larger emergency response departments too, but not in the same way.
They have money, larger budgets, money that can be reallocated, moved around from, let's say, a surplus or a rainy day fund.
There are many local small emergency response agencies like ours. It's very, very detrimental to us being able to manage these budgets and also progress agencies forward to ensure that we're prepared for emergencies when they happen.
Despite their concerns of what the coming months may look like, these officials all wanted to make one thing clear.
When emergencies happen and people dial 911, they're going to get service. No matter what, when the call comes in, we're going to respond to the absolute best of our abilities. However, community members need to be aware of the problem. We're fighting it just the same as you are in your home.
Isa is joining us now. And Isa, that last maybe 15 seconds, I think is so important there, right? Saying, if you call 911, you will get help. Like, this is not going to affect, because I don't think what we don't want to do is freak people out. They're making the point, these officials you're talking to, yes, this is an issue. It is not going to affect your level of service, but it is something to be mindful of, sort of on a broader, less urgent way, I think is fair to say.
That's exactly right, Hallie. They're going to make cuts elsewhere to ensure that their response time is not cut down, especially for those emergencies, right? That being said, this will have impacts, they say, for regular people in other ways. You know, you heard about cutting back on those pre-emergency activities, building inspections, for example. That's something you don't really think about very often until it's too late, right? And some of them are having to cut back on those. Another really interesting thing that the chief from Colorado pointed out to me are ambulance costs. So I didn't know this myself, but these departments are paid a flat fee to operate these ambulances, and they don't account for fuel surcharges. And insurance, Medicaid, Medicare, they don't cover that either. So that's coming out of the patient's pockets right now, something you don't think about, but just unbelievable how these costs trickle down to the patient, even in these traumatic and already very expensive experiences.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.